Hello everyone, welcome to Choitram's HR Shared Services eInduction session. HR Shared Services Overview for GCC. We provide centralized HR shared services support across the Gulf Cooperation Council (GCC) and India region. Our services include the following: HR systems. We build and manage HR management systems to streamline HR operations for our teams in the UAE, Bahrain, Oman, Qatar, and India. Compensation and benefits. We design and manage all aspects of compensation across the GCC and India, from salaries to benefits, such as group health and life insurance in accordance with each country's compliance. Additionally, we oversee performance management process. Immigration and compliance. We handle legal and regulatory requirements, managing work permits and employment visas, Emirates ID, and ensuring compliance with labor laws in each of our focus countries. HR reports and analytics. We create insightful reports and analytics to represent employee data clearly, helping our business stakeholders in each region to make informed decisions. Onboarding and payroll management. We ensure a smooth onboarding process and accurate, timely payroll for employees across all supported countries. Let's take a closer look at the HR systems we use at Choithrams to ensure smooth HR operations. SAP. This robust tool is primarily utilized for onboarding, data maintenance, and payroll processing. Notably, payroll for all our GCC countries is centrally managed through SAP in the UAE, ensuring efficiency and accuracy. HR application. Our in-house developed HR management system, HRMS, is designed for time and attendance management. It also facilitates various HR functions, such as raising leave requests, handling employee transfers, and processing bona fide requests. HR Service Desk, Manage Engine. This is our ticketing module for addressing employee queries and issues. Employees can raise tickets in Manage Engine, which will then be assigned to the respective single point of contact, SPOC, for resolution. Power BI. We use Power BI for analytics to create insightful reports and dashboards that represent employee data clearly. This tool helps our management make informed decisions based on actionable insights. Let's move into the next core service in HR shared services: compensation and benefits. At Choithrams, all employees receive health insurance coverage upon joining. Group Health Medical Insurance, GHMI. We have two separate GHMI policies. One for employees holding Dubai and Northern Emirates visas, compliant with Dubai Health Authority, DHA, regulations. Another for employees holding Abu Dhabi and Al Ain visas, adhering to Health Authority, Abu Dhabi, HAAD, guidelines. In this section, we will cover the following: insurance card details. We will show you the insurance card and explain the information it contains. Understanding network. We will clarify what network means in the context of insurance and guide you on how to avail benefits at our network providers. Table of benefits. We will present a table outlining the major benefits you are entitled to under the insurance plan. Reimbursement eligibility. We will explain the eligibility criteria for reimbursements and the process for claiming them. Once we have covered GHMI, we will move on to the workman compensation policy, where we will explain what a workman compensation accident entails and the actions to take if such an incident occurs. Now, let us move on to understanding the insurance cards of DHA policy. This is applicable only to employees holding visas issued in Dubai and Northern Emirates. In DHA, policy are divided into two categories based on salary band: Category A and Category B. Let us look at the insurance card for Category B, employees first. As you can see, this is what the insurance card for category B looks like. Let's walk through the important details on the card. At the top, you will see the name of the insurance company, which is National General Insurance (NGI). Below that, you will find the name of the company T. Choithram and Sons. Following that, the employee's name will appear. Next, you'll find the following details on the card: unique health card number, date of birth, nationality, Emirates ID number, policy number and insurance category, validity period of the insurance coverage, employee ID under staff number, the name of the network on the card. Understanding the network. Now, let's talk about what a network is. A network refers to the list of hospitals, clinics, and pharmacies that are covered under our insurance plan. While there are many healthcare providers in the UAE, only those in the network are covered by our insurance. For Category B employees, the name of our network is FMC. Standard Network. You'll also notice the TPA, Third Party Administrator, logo in the bottom right corner of the card. The TPA for Category B employees is FMC. TPA is an organization that manages insurance claims and services on behalf of the insurance company. They handle various functions such as claim processing, managing cashless hospitalization, and offering customer support. That's a quick overview of the insurance card, TPA, and network for Cat B. In the next slide, we'll understand about insurance card of Cat A employees. Now, let us look at the insurance card for Category A employees. As you can see, the insurance company name and logo on the card, which is National General Insurance (NGI). At the top, you'll notice the name of the TPA, which is HealthNet. TPA, as you know, is the third-party administrator, is an organization that manages insurance claims and services on behalf of the insurance company. Then, we have your unique card number, followed by your name, date of birth, category, staff ID, and the validity period of your coverage. Also, the name of the network is mentioned, which in this case is HN Basic Plus. As we discussed earlier, the network refers to the group of hospitals, clinics, and pharmacies covered under the insurance. Copayment eligibility details are also mentioned in the card. Copay or copayment is the amount or percentage of the medical bill that you, as a member, are responsible for paying out of pocket. This means that when you visit a healthcare provider, a certain portion of the cost must be borne by you, while the insurance will cover the rest. Now, let us take a look at how you can download your insurance card from the HR application. First, log in to the HR application. Once you're logged in, select the AMS and LMS module. Next, click on Employee Master. When the Employee Master screen opens, enter your employee code and press Enter. Now, click on the Employee Details tab. Once that opens, you'll find the option for Certificate View. Select Medical Insurance Card from drop-down. This will open your insurance card, and from here, you can easily download or save the card. Now, let us see how you can use your insurance card when seeking medical treatment in a network facility. First, the clinic hospital will send a request for treatment to the insurance company. This request is then reviewed by the TPA. The TPA will verify the request, and once approved, you can proceed with the treatment at the clinic. However, if the TPA needs further clarification about the treatment, the request will be suspended for review. Once the TPA gets the necessary details and everything is justified, the request will be approved. But, if the TPA finds that the request doesn't fall under the insurance policy benefits, it will be rejected. In this case, you as the member would need to cover the medical expenses out of your own pocket. So, it's important to make sure the treatment is within the policy's guidelines to avoid any rejections. In DHA policy, employees are divided into two categories. Category A and Category B, based on their salaries as per DHA mandate. All employees whose base salary is less than or equal to AED 4,000 falls under Category B, and all employees whose base salary is AED 4,001 and above falls under Category A. Let us look into the table of benefits Cat A and Cat B. Area of coverage for Category B employees. They will have insurance coverage in UAE and their home country, excluding USA and Canada. And for Category A employees, they have worldwide coverage excluding USA and Canada. Annual limit of insurance for both categories is AED 1,50,000 per year. TPA and network for Category B employees is FMC and standard pre-existing respectively. HealthNet is the TPA and HN Basic Plus is the network of Category A. Now let us see the benefits under insurance in case of inpatient treatment. In insurance, inpatient (IP) treatment refers to medical care that requires a patient to be admitted to a hospital or healthcare facility for at least one overnight stay. Inpatient and daycare treatment is covered for both Category A and B. In case if employee is availing room during an inpatient treatment, Category B employees will be eligible for semi-private room up to 90 days. And Category A employees will be eligible for private room up to 90 days. For Category B employees, nursing at home is not covered, whereas it is covered for Category A employees. Pre-existing conditions refer to medical issues that existed before the insurance policy started or prior to joining this company. Examples like diabetes, asthma and chronic conditions are long-term health conditions that typically require ongoing management regardless of when the condition began. Example, chronic heart and kidney disease. Coverage for pre-existing and chronic diseases for Category B is as follows. It is fully covered for the existing members and for new additions. Waiting period of 6 months and annual limit thereafter. For Category A, it is fully covered for the existing members. And for new additions up to 20% of annual limit for the first 6 months. An annual limit thereafter. During inpatient treatment, the cost of accommodation of a person accompanying an inpatient in the same room in cases of medical necessity will be AED 100 per night in case of Category B employees. In case of Category A, it will be AED 150 per night. There is no copayment during inpatient treatment for both categories. Diagnostics and procedures like X-ray, lab test, CT scan are covered under inpatient treatment for both Category A and B. Let us now look into the benefits employees will be eligible during outpatient treatment. Outpatient treatment means you get medical care without staying overnight in a hospital. You visit a clinic or hospital for your treatment and then go home afterwards. For consultation, for Category B employees, if they need to visit a specialist, it needs to be via a GP referral. Also for appointments in hospitals, it has to be via GP referral. Coinsurance is applicable for consultation. 20% coinsurance max AED 25 at hospitals. 20% coinsurance max AED 25 at clinics. No coinsurance if a follow-up visit made within 7 days for the same illness. For consultation, Category A employees can directly access to specialist doctors. Also, they can directly access hospitals. 20% coinsurance max AED 50 at hospitals. 20% coinsurance max AED 25 at clinics is the copayment applicability for consultation. No coinsurance if a follow-up visit made within 7 days for the same illness. Diagnostics and procedures are covered for both categories, with 10% copay for Category A and nil copay for Category B. Pharmacy limit for Category B is up to AED 13,000 with nil copay and up to AED 15,000 with 10% copay at hospitals and clinics. Maternity limit for both categories is same. 10% copayment for outpatient and inpatient services with annual limit. AED 10,000 is limit for both C-section and normal delivery. Newborn will be covered up to 30 days under mother's policy from date of birth. After 30 days, separate policy needs to be taken for the newborn. Dental and optical treatments are not covered for Category B employees, but they can avail 50 and 20% discount respectively in specific FMC dental and optical network. For Category A employees, up to AED 1000 coverage is available with 20% copay for dental cover. And for optical it is AED 500 with 20% copay. Physiotherapy is covered up to 10 sessions with nil copay at hospitals and clinics for Category B employees. For Category A employees, up to 18 sessions covered with 10% copay at hospitals and at clinics. Other benefits covered under insurance are return airfare for inpatient treatment up to AED 5,000 on reimbursement basis. Pre-existing and chronic diseases are covered for both categories. Alternative medicines like homeopathy, Ayurvedic medicines are covered as follows. Up to AED 1000 with 20% copay for Category B employees. And up to AED 2500 with 20% copayment. Please refer to the table of benefits and network list shared by HR department through email to your process champions for more benefits and detailed explanation. In this section, we will cover the eligibility criteria and process for reimbursement of medical expenses. Employees are strongly advised to visit network facility for planned treatments to ensure the smooth coverage. Reimbursement will only be approved for treatments at non-network facilities in emergency conditions, and when the condition is declared life-threatening by a doctor. Inpatient home country treatment reimbursement option is available subject to prior approval. Prior approval from the insurer is mandatory for any inpatient treatment to be considered under direct billing or reimbursement for inside UAE and outside UAE. Reimbursement at non-network facility is covered for Category A employees, whereas it is not covered for Category B. Following are the reimbursement timelines to be followed for Category B employees inside or outside UAE. Documents should be submitted within 90 days from the day of treatment. For Category A employees inside UAE, documents should be submitted within 30 days from the day of treatment. Outside UAE, documents should be submitted within 90 days from the day of treatment. It is essential that all employees adhere to the mentioned timelines. If documents are submitted after the specified time, the claim will be rejected. To successfully process your reimbursement, the following documents must be submitted: a signed and stamped claim form from the treating doctor, an invoice showing the cost per service and proof of payment, a full and detailed medical report, including the diagnosis, test reports, prescription, and discharge summary. Depending on the nature of your treatment, the insurance provider may request additional documentation. Please be sure to provide these promptly to avoid delays in your claim. We have covered the insurance card and table of benefits of DHA policy. Now, let us look at the insurance card of HAAD policy. Kindly note, this is applicable only for those who are under Abu Dhabi and a lane visa only. As you can see, the insurance company name and logo on the card, which is Qatar Insurance QIC. Then, we have your name, date of birth, and unique health card number, followed by validity and staff ID. In the bottom left corner, you'll notice the name of the TPA, which is NAS. Let us now check on the detail of the table of benefits of HAAD policy, which is applicable to Abu Dhabi and Al Ain visa employees. Area of coverage worldwide, excluding USA and Canada. Annual limit of insurance is AED, 2,50,000 per year. TPA and network is NAS and WN covered, respectively. Now, let us move on to the benefits of insurance while availing inpatient benefits. Inpatient and daycare treatments are covered in case if any employee is admitted to the hospital and taking treatment. The room type that will be available is a semi-private room. Existing and chronic diseases are covered under inpatient treatment. The cost of accommodation of a person accompanying an inpatient in the same room, in cases of medical necessity, at the recommendation of the treating doctor, and after the prior approval of the insurance company, providing coverage will be maximum AED 100 per day. Inpatient maternity, covered up to the annual limit with deductible of AED 500 within the Emirate of Abu Dhabi. Maternity services outside Abu Dhabi and outside UAE is covered up to AED 10,000 for both normal and C-section complications and for medically necessary termination. Copayment is not applicable for inpatient services, including diagnostics and procedures like X-ray, lab test, CT scan, etc. Now, let us cover the benefits during an outpatient treatment consultation. For both specialist and general practitioner is covered with deductible of AED 50. The rooms per outpatient visit. Diagnostics and procedures are covered, and the pharmacy limit is up to AED 10,000. With nil copay. Kindly note, only formulary medicines will be covered. Routine maternity is covered under outpatient benefits, wherein it is covered full inside the Emirate of Abu Dhabi, with a deductible of AED 50 per each claim. Newborn baby will be covered under mother's policy up to 30 days from date of birth. Dental and optical claims will be covered during medical emergency cases. Prescribed physiotherapy is covered. Transportation expenses for inpatient treatment abroad will be covered. Maximum up to AED 5,000 per person per year subject to treatment is taken more economically in these countries, with maximum of 70% of the UAE benchmark rate, and obtaining prior approval from insurance companies TPA. Pre-existing and chronic diseases are covered. Insurance companies offer mobile applications for easy access to medical benefits, simplifying the process for employees. These mobile applications provide the following services. Download your health insurance electronic card, e-card. View policy details and search for network providers. Check the live status of your authorizations during hospital or clinic visits. Submit claims online, and much more. Let's see first how you can download the FMC mobile application for Category B employees. For Android users, the FMC mobile application can be downloaded from the Google Play Store using the following link or by scanning the QR code. For iOS Apple users, you can download the FMC mobile application from the App Store using the following link or by scanning the QR code. Name of mobile application for Category A employees is NGI. Let's now see how you can download the NGI mobile application. For Android users, the NGI mobile application can be downloaded from the Google Play Store using the following link or by scanning the QR code. For iOS Apple users, you can download the NGI mobile application from the App Store using the following link or by scanning the QR code. Name of mobile application for HAAD insurance is MyNAS. Let's now see how you can download the Mynas mobile application for Category A, Employees. For Android users, the Mynas mobile application can be downloaded from the Google Play Store using the following link or by scanning the QR code. For iOS Apple users, you can download the Mynas mobile application from the App Store using the following link or by scanning the QR code. Let's move on to discussing another insurance benefit, the Workmen Compensation Policy. Workmen Compensation Policy will come into picture during a work-related accident. A work-related accident refers to any injury, illness, or incident that occurs while an employee is performing their duties at work. This includes accidents that happen at the workplace or while traveling for work-related purposes. Some examples of work-related accidents include getting an electric shock while using equipment or while turning switch, slipping downstairs at the office or workplace, accidents involving drivers while driving for work, getting a cut on your hands while working as a butcher. In the case of a work-related accident, employees should not use their GHMI cards at the hospital for treatment related to the accident. In the unfortunate event that an employee gets injured while working, the following steps should be followed to ensure proper handling of the situation. Step 1. If an employee gets injured while working, they must inform their manager, process champions, and the health and safety officer within 24 hours of the incident. Step 2. Upon receiving the injury details, the manager or process champions must immediately raise a work-related accident request in the HR app as soon as they are informed. Step 3. The manager will provide the injured employee with cash, up to a limit of AED 1000, from the petty cash, once HR approval is received. The employee is then sent to the nearest clinic or hospital for treatment. Step 4. The employee receives treatment at the clinic or hospital and is either discharged or admitted if necessary. Step 5. After treatment, the employee submits the original bills and medical reports to their manager or process champions. Step 6. The manager or process champions will verify whether the employee has completed the entire course of treatment and inform HR. Step 7. Once the treatment is confirmed as complete, the manager or process champions must scan and submit copies of all the documents to HRSS. The total treatment cost should be included, and the original documents must be sent to the HRSS department at the data head office. Please note that any follow-up treatments after this confirmation will not be covered. Claim documents should be submitted to HR department within 60 days from the discharge date of the employee. Step 8. In non-LS retail stores and other offices, the process champion or cashier must make the necessary journal entry in the chief system by passing entry in the staff's personal account with a remark stating work-related accident. Step 9. In LS retail stores, the process champion must pass an entry in the debtors control account (GL) to 500493 with the remark work-related accident. Step 10. HRSS will then submit the claim to the brokers or vendors for processing. Step 11. Once the claim is settled, any amount spent will be reversed from the respective account. Remember, any accident that happens during work duties should be reported as a work-related accident, and you should follow the proper procedures for treatment and reimbursement. Let's now talk about a very important benefit introduced by the UAE government, involuntary loss of employment (ILOE) insurance. Starting from 1st January 2023, ILOE insurance has been made mandatory for all employees working in both the private and government sectors here in the UAE. So, what is the benefit of ILOE? In case of involuntary loss of employment, meaning you lose your job due to reasons other than disciplinary action or resignation. This insurance provides you with financial security while you search for new employment. Under the ILOE insurance, eligible employees will receive a monthly cash benefit of up to 60% of their average basic salary for the 6 months prior to the loss of employment. This benefit is available for a maximum of 3 consecutive months. However, to qualify, employees must have paid the monthly premium for at least 12 consecutive months. Let's quickly go over the eligibility criteria for ILOE insurance. All employees working in the private sector and federal government are eligible. Next, let us see about the coverage limit and the premium amount you need to pay for the involuntary loss of employment (ILOE) insurance. For employees with a basic salary of less than 16,000, the coverage will be up to 10,000 per month for a maximum of 3 months. For employees with a basic salary of more than 16,000, the coverage will be up to 20,000 per month for a maximum of 3 months. Now, let us look at the premium amount employees need to pay. For employees whose basic salary is less than or equal to 16,000, the premium will be 126 including VAT for 2 years of coverage. For employees whose basic salary is more than 16,000, the premium will be 256 including VAT for 2 years of coverage. An important note, since this is mandatory for all the employees in UAE, the company will make the premium payments on behalf of employees on an annual basis, and the amount will be deducted from your payroll. However, if you've already registered yourself on the ILOE portal, you must share your certificate with your respective process champion so that it can be updated in the HR application. Now, here's something important to keep in mind. There are fines for non-compliance. If an employee fails to register and make the payment within the grace period, a fine of 400 will be imposed. And if an employee fails to pay the prescribed insurance premium for more than 3 months, a fine of 200 will apply. Now, let's walk through the process followed by the immigration and compliance vertical for a new candidate who has been selected. Job offer. The process begins with the job offer being made to the selected candidate. Work permit approval. Once the job offer is accepted, we move on to obtaining work permit approval, ensuring the candidate has the legal authorization to work in the UAE. Entry permit and change of status. Next, we process the entry permit and any change of status documentation, allowing the candidate to legally enter and work in the country. DHA Medical and Emirates ID Biometric. Upon joining, the candidate will need to complete their DHA Medical and Emirates ID biometric process, which typically takes around 1 week. GDRFA approval. Following the medical process, we submit the application for GDRFA approval, which takes about 1 week to complete. Issuance of Emirates ID. Finally, once all approvals are in place, the Emirates ID card is issued, usually taking around 14 working days. We have created an HR analytics platform that simplifies employee data, making it easy to understand and analyze. Built on Power BI, this platform provides key insights on employee-related information, enabling management to make well-informed decisions on people data. Now, let's discuss payroll administration. Our payroll process is centralized and covers employees across 5 countries: the UAE, Bahrain, Qatar, Oman, and India. Payroll processing timeline. Attendance period. Attendance for payroll is recorded from the 21st of the previous month, to the 20th of the current month. For example, for January's payroll, attendance data is collected from 21st December to 20th January. Important deadlines. Monthly attendance cutoff. The cutoff for closing attendance is the 22nd of each month. Any leaves, incomplete scans, or corrections must be updated in the HR application before this date. Leave approvals. Managers must complete leave approvals in the HR application by the 22nd of each month. Leaves not approved by this date will result in loss of pay, so timely applications and approvals are crucial. Employee transfers. The cutoff date for employee transfers is the 26th of each month. Transfers raised after this date will be updated in SAP only on the 1st of the following month. Vacation settlement and airfare. Now, let's move on to the process of vacation settlement and airfare for employees going on annual leave. Employees are eligible for vacation settlement and airfare when taking annual leave. These payments are processed along with your regular salary at the end of the month. Example: if you apply for leave from 15th January to 13th February, in January's payroll, you will receive your regular salary for the first 14 days, 1st January to 14th. For the period from 15th January to 31st, you'll receive your vacation settlement and airfare. In February's payroll, you will receive your vacation settlement and airfare for the first 13 days, 1st February to 13th. From 14th February to the end of the month, you will receive your regular salary. If you have any questions, please write to us in the email address below. Thank you for going through this induction. Welcome aboard. And we wish you success in your role.